Thank you very much, Karen, and lovely to be here today. So my brief over the next 10 minutes is to give an All-Ireland perspective from the perspective of the South on adult palliative care research and policy. So that is a topic that could take up all of the day. So I'm going to give you maybe a little bit of a signposting. And there are a number of members in the audience that were very involved in terms of the delivery of the palliative care policy. So there'll also be some experts that will be very happy to speak to you, I'm sure, during coffee breaks and so on. So just to start with the disclaimer, I have no conflicts of interest to declare, and I think I'm speaking in this role because I chaired the steering group for the development of our national palliative care policy that was published in 2024, and this was a ministerially led document and published by the Department of Health. But just as a disclaimer, I'm not speaking on behalf of the Department of Health. So just to orientate ourselves before we move into the specific topic of research in palliative care in Ireland, the adult palliative care policy sits within the context of the overall cross-party consensus that was achieved back in 2017, which guides the reform of Irish healthcare service provision. And the goal of this cross-party reform programme, which is termed Sláinte Claire, is the achievement of universal healthcare in Ireland. And what that actually means is that all people in Ireland should be able to easily access, so access is a big component of it, quality care. And exactly what constitutes quality care is a very important component in terms of the definition, without financial hardship. And because that is such a huge endeavour, there are many moving parts to that jigsaw puzzle. So people may be aware of some components of the reform programme, maybe that the shift from hospital-based practice to supporting community-based practice, the idea of integration and supportive services, the idea of catering to the needs of an ageing population. So there'll be all of these little lenses or different perspectives that will come together, as they say, that old tale of, looking at the elephant and trying to describe the various bits. So there'll be pieces that everybody will be familiar with, but the overall goal is the achievement of universal healthcare. And in terms of, I suppose, an easy way or a way of communicating that, because messaging and understanding and engagement is so important, you'll often hear Sláinte Care talked about in terms of delivering the right care in the right place at the right time. So the Sláinte Care report actually specifically referenced the delivery of universal palliative care, and that was one of our very big first important milestones, gaining that recognition. So in terms of the goal of the adult palliative care policy, well, it was very clear to that group at the outset what our goal would be. And that is the delivery of universal palliative care, which means that all people have access to the full range of quality palliative care services that they need when and where they need them without financial hardship. In terms of, again, the messaging of this complex document, the way that we like to think about it is that we're delivering one goal. That's the journey, that's the destination. And the way that we're dividing up the work is that we're looking at 4 important strategic objectives. And we borrowed from the strapline of Sláinte Care to say that our 4 strategic objectives were the delivery of the right care, but in the right place at the right time, delivered by the right people, as the 3rd pillar. And we added in the 4th pillar of ensuring that all of this was done under a pillar of good governance. Because I think we've already had the importance of integrity, authenticity, quality assurance, and that is key to the provision of health and social care. And it merits being pulled out as an embracing and interweaving concept that goes through all of the pillars, but just paying that special attention. And for the purposes of this talk, research is in under that good governance pillar, because research is central to the production of evidence-based care, innovation, delivery, moving forward. What is the next phase, the next step in the journey that we need to be moving towards? How can we quality assure and know how our services are being provided, how are our patients and carers being supported to the best possible way, and importantly, how also are our staff, supported to be flourishing in the workplace, demonstrating resilience and skill. And in terms of those 4 strategic objectives, we had 25 recommendations, which we saw a little bit like the James Lind Alliance. What were those 25 key recommendations that would move us forward to achieving our strategic objectives and eventually our goal. And those 25 recommendations, 7 sit under the first pillar and 6 then in each of the other pillars. And then because, as we're talking about implementation, we need to move things off the shelf. It's not a document that is words, it's a document that is actions. We then underpinned each of those recommendations with a range of activities that would give people concrete tasks to move us forward into the next phase of development. So that's the National Adult Palliative Care Policy, a document I think that everybody is really, really proud of. And in terms of the summary, to orientate people, we call about our house of care. And what you can see there in the roof is the goal, and then you have your 4 strategic objectives. And then you see your recommendations sitting under each of those pillars of the recommendations. Are over 100 activities summarised below, and then we have some of our quality indicators and our implementation principles as the foundation or the rock, the bedrock of how this is going to be put into practice. So right care, ensuring the provision of safe, effective, person-centred palliative care, making sure that it's available at the right time and place, that is provided by a workforce that's appropriately resource skilled, supported and valued to provide palliative care, and then this key one of governed well. So we're talking about strengthening clinical leadership, accountability, developing culture, building coalition, and then really into that research and innovation space, ensuring that we're intelligently using information and we're developing research, innovation and QI capability. So just in terms of, people can look at this maybe a little bit later, but there's you see 7 recommendations, 6, 6 and 6. And then recommendation 25 is the one that we're going to be focusing on, which is the developing and supporting research and innovation in palliative care. So you can see across the good governance, we're talking about governance systems, we're talking about quality and safety, we're talking about the development of information systems, focusing on medicines and technologies, focusing on accountability, and then this one of research and innovation. So research and innovation, infrastructure and systems will be developed in academic palliative care, and a sustainable academic workforce will be developed. And then this really, I suppose, are the activities, the pieces that the Department of Health, the HSE, have committed and are working towards with their partners, including important bodies such as the Health Research Board, as you'll see there. And you can see within the policy there was an indicative commencement date, which was then, which I'll talk about, was further looked at and refined in the implementation plan document. So the activities that sit under this strategic action or on developing palliative care research and innovation. I'm going to start, you can see there 25.1, overall just this umbrella piece of developing a strong and supportive environment for palliative care research in Ireland through investment in infrastructure and researchers. So there is a commitment there, a recognition that the research infrastructure in Ireland in palliative care is perhaps immature in comparison to some other areas of health and social care provision. And as such, it does need focused effort to build that. And the All Ireland Institute has been in this space for 14 years, and we're building and growing in that and has made great strides. But on a national level, we need to continue to invest and develop our capability. We're looking specifically then in 25.2, the idea of research and innovation fellows, and this particularly was looking at developing the pipeline of researchers to bring them into the mature researcher and professorial space, but very importantly looking at areas of policy applied research. Both we had identified gaps in knowledge that would be relevant in terms of further implementation of the policy, and also there are very important learnings in terms of this policy that potentially should be captured and transferred elsewhere. We're looking at, in 25.3, the idea of the national development of a national palliative care research knowledge transfer function. Again, the All Ireland Institute has made great strides in this space, but it's not just about generating knowledge, as we say, it's about communicating and utilising it, and that's why it's so important to think about that end product there. We're talking about the further development of the specialist palliative care education research centres, but moving them beyond the hospices into fully developed academic partnerships with the wider research and education infrastructure. And we're looking then specifically at the development of clinical academic posts. And there you'll see that idea of the integrated palliative care network and partner universities, and the idea of the academic health system, and importantly, the development of workforce planning models, which will ensure that there is an engine that continues to drive this forward. So the policy was very well considered and thought out and planned by the Department of Health. They really had considered all of the lessons that they had accumulated over their vast experience in terms of policy development, and very clearly in the terms of reference was the requirement to not just develop a policy, but to lay out an implementation roadmap and the structures for further assuring this work. And this diagram is taken from the policy document and talks about the idea that the policy, although detailed, isn't the full work plan for the next 8 years. It can't be. That's not what a policy document is. But it lays out the implementation roadmap, which is the next step of the actual implementation detailed plan, which becomes the blueprint then that drives the partners forward in terms of its implementation. And the structures then that ensure stakeholder engagement and ongoing evaluation. And I'm really pleased to say that, the proof of the pudding is in the eating, and as had been promised, the HSE has produced the first iteration, the first stage of the implementation plan. And here you see for the 25-26 work plan, those specific activities now translated into the actual granularity of what the HSE and partner bodies are doing. And you'll see there the idea of 15.3, which was the strengthening of the idea of the academic development, the academic to partners. Well, the mapping it out. First stage, the region to review the academic relationships. You'll see in later areas, there's about then developing the workforce model. Then there's the piece around about developing the business cases, and then it'll move into the service planning process. So you see that real clarity that people can track and evaluate and change direction as needs be if we're iterative in our plan, do, study, act cycle. So you see there again the clinical academic posts, the national transfer knowledge function. So for this year into Q3 of 26, the idea of doing the scoping paper is what would that national transfer function look like? Look at an evidence-based, go out and seek that, and then we'll know what to commission going forward. So I focused on I suppose the policy document, and I'm conscious it's a little bit of a whistle-stop tour, and there's an awful lot of information there. But I suppose just to call out, I see Fargal Toomey as our clinical lead for the National Palliative Care Programme in the audience, and Fargal and Morris were absolutely key together with their colleagues in the HSE and department, and we see Paul as well from the Department of Health as well. So in driving this forward, and really they've been living, breathing, eating, sleeping that implementation policy over the last while. So although I'm focused on the palliative care policy, as we mature as a specialty, as a discipline, as an approach to care, it's really important that we move from, our own little ecosystem into standing full square with the broader, wider research ecosystem and infrastructure. Our success will only be really measured when we are considered part of the mainstream, and we can stand head to shoulders with colleagues in other specialty or discipline areas and so on. So we really need to think about this broader research ecosystem, and this is why a day like such as this and the Institute is so good at bringing those networks, those people together, thinking about the universities, the state research institutes, the government funding and support organisations such as the HRB. Think about our international collaboration networks, our All Ireland partners, our PPI engagement, and our partners with our healthcare organisations. All of these people, it takes a team. So as a final word, again, this piece around the, implementation is so important. As part of the policy document, very careful consideration was given to trying to troubleshoot all of the pitfalls and barriers to policy implementation. And we tried to build all of those things and mitigate against them as far as was possible. But what you'll see there is that in order to implement a policy document, it takes a village, it takes a country. And this is the part that all of us in the room have this part to play. So this is the part of stakeholder engagement. It's about coordination. It's about interagency coordination, collaboration and integration across disciplines. So this is so wonderful to be able to talk to it today so that we really continue, not start because we are well on the journey, continue building the momentum of implementation. I suppose we spoke in the forward to the policy document about the Irish saying, Ar scáil chéile bhar na dílean na daoine. You know, we live in each other's shadows. Palliative care is a community, a collective enterprise, and the implementation of this research agenda is a community endeavour also. Thank you. And sincere thanks to you.